Welcome and thank you for joining us for our second half hour, The Factor Uncensored. Ozempic was created to treat diabetes in patients, but as you know by now, many people are using the drug to slim down. But is it also affecting people in various ways? A woman in South Dakota posted this side-by-side picture of herself on Facebook. She says that her breasts are actually or have shrunk or gotten smaller. About to make me mess up a verb there. While using Ozempic. Ozempic breasts join the list of alleged side effects. Ozempic personality, Ozempic pregnancy, and even Ozempic face. Are any of these legitimate side effects? Joining us to talk about it, OBGYN, Dr. Marcel Thompson, and also owner of LushRx, Crystal Roney Smith. Glad to have you here both on The Factor. So, doctor, when you hear some of these Ozempic breasts, Ozempic face, your thoughts about all of this?
Well, anytime you lose a great significant amount of fat loss, you're going to have some changes. You have skin lag, you have, and particularly with Ozempic, you have also some muscle wasting. So in a lot of things, it's just more so the appearance of more fat loss will cause sometimes skin sagging, and then sometimes they're researching so far as when you're losing the weight that you may increase your breast tissue. So you have some fluctuations, but overall, the overall aspect of most people on Ozempic or the semaglutide or the tirzepatide they lose a significant amount of fat and some significant amount of muscle with it.
All right, Crystal, what's your perspective on this when people say I'm Ozempic this, I'm Ozempic that, and it's just getting crazier?
I call it Ozempic effect. You know, if we think about the Nutty Professor and Buddy Love, how he lost all that weight and had all that testosterone he was going, I just feel that it has a lot to do with dosing. You know, a lot of providers are jacking up the dose, and so they're losing weight rapidly. And this, like he said, is real hard to hold on to muscle when you're losing a lot of fat. The breast is made solely of fat, so if you're losing rapid weight, you're going to lose breast, you're going to lose booty, you're going to lose face, and those are a lot of the areas where, you know, are heavy in fat. And as far as the personality is, like when you start looking good and feeling good, I mean, hey.
You got Ozempic attitude. Coming here with that damn attitude, all sassy.
A lot of people are losing like 20% of their body weight, and that is a significant difference. And of course, you're going to have pregnancies and personality disorders and everything after that. Do
you guys see any positives or any negatives overall in using Ozempic other than, you know, cheating people who need it for diabetes because they can't get it or because so many people are using it? But do you see any negatives out there?
The negatives, I think, is the aspect of once you start it, you know, without having real true change and looking at why you started, without having an end point to it. Because one of the things that Big Pharma likes about it is that once you start the Ozempic, it will decrease your appetite. So if you stop it, your appetite's going to start increasing. So a lot of people, it's hard to stop, or they restart it again. So I think if you have the intent of what the medication was used for, the same medication is also used for weight loss, but it's addressing the diet. It's a very good drug that controls cholesterol, it will control, you know, A1C levels, and you'll lose weight. But if you don't have the right intention on a good diet plan on how to come off of it, you will. That's, to me, the biggest negative. And also with, like I said, the muscle wasting is a big negative to it.
And have we seen, Crystal, anybody yet or any people yet who have blown the hell up after they've stopped taking it?
I think you have to address what he said, the reason why you're on it. A lot of these people have disorders before they start Ozempic. Some of them have food cravings and overeating because of depression and anxiety. Some of them have body dysmorphia. So if you start a weight loss drug, lose weight, and you don't address those parties, you're going to yo-yo and you're going to gain weight. But in our clinic, what we do is we do an in-body assessment where we put them on the scale and it tells them how much body fat, how much muscle, and we also address something called visceral fat, which determines whether you're at risk for heart disease. So when you show people these numbers, they're more serious to keep the weight off, and they won't typically gain that weight back because it's more about whole health.
And let's talk to you from the perspective of using your insurance to get it. Many people have cautioned using your insurance, saying that if you use your insurance to get Ozempic, then you would have diabetes on your medical history, and your insurance company would see that. Any validity to that? Do you?
Well, sometimes it varies with the insurance companies and which type of plans that you have. There is, so you do have insulin resistance, in which a lot of women, particularly if they have polycystic ovarian syndrome, a lot of different women or men who have signs they have metabolic syndrome, they get increase in weight, cholesterol is off. So you could sometimes make a good argument, and the FDA is just approving for cardiovascular problems. So if it gets approved for a cardiovascular problem, then it opens up a whole litany of reasons why.
Yeah, they can't say it's just this,
right?
And so let's take up your insurance weight.
Correct. So it just really varies on the type of insurance that you have. I've seen, we normally try to see if the insurance will cover the Ozempic, if I have a good medical reason why they need to be on the Ozempic. But it's also good to pair it with other types of peptides or hormones too.
How expensive is it? For those who are wondering, out of your pocket, is it expensive?
You're going to look to spend anywhere on the low end of $200 up to $1,000 a month, depending on if your insurance covering, or if you're giving it compounded, or if you're getting it off Amazon.
No damn Ozempic off Amazon. What you trying to do?
Don't get it off Amazon. Come to Lush RX or Dr.
Coming to
Thompson.
you guys. All right, thank you both.